Good day, everyone. I'm Ivan, the moderator for this webinar. I welcome everyone to today's webinar, Preventing and Responding to Active Shooter Situations in Healthcare. I would now like to introduce our presenter for today, Mike Cummings. Mike Cummings, CPP, is a 50-year veteran of private security with the last 37 in the healthcare sector. I would now like to hand over to the floor to the speaker. Over to you, Mike.
Thank you very much, Evan. Good afternoon or good morning to the participants, depending on where you're calling in from. It's a real pleasure to be here today on behalf of Conference Panel and to make this presentation on a topic that's near and dear to my heart. So let's get started with an overview. There continues to be a rising frequency in both severity and randomness of active shooter situations across our country. The other part of active shooter situations is keeping in mind there can be two specific types, generally speaking, and they are targeted and non-targeted. One of the outliers in healthcare is now I'm going to launch into some foundational elements that you should have in your program. First and foremost, consider active shooter prevention, whether it's identifying it and learning how to respond to it, how to deal with it in real time or after the fact, should not be a standalone program. Active shooter prevention is and should be considered part of your overall workplace violence prevention program. As you prepare your organization and your hospital or your clinics or whatever, however large your system is or individual facility is, some of the general considerations that you'll have to deal with will be some of the foundational elements, and this is a really key one. Then identifying the team. I've thrown up some specific departments, and training is going to be a huge part of all of this. And so your training department leader or leaders of training from various departments will also need to be there. So let's talk about education and training. All staff will need to be well-versed in both education and training. The next element that I'll talk about is real-time campus notification. It needs to have both physical and procedure elements. So other response protocols, let's get into some response protocols. Establish criteria for initiating it. The criteria should be very, very basic. Training, I'm going to go through this again quickly. That should be more in-depth and task-focused than the overall education. It should have increased frequency. Again, it should be formal and informal. It should have competency elements for things that people really have to do. Should have documentation. So in the worst case scenario, you can document that all of these officers, all these switchboard people, all of these nurses had their training, and it should be redundant, as I said, with other formal and informal. And it should be kept in mind that the training should keep in mind what your appropriate staffing level is. These are all things that you need to consider as you're developing your training. So let's talk about drills and exercises, and I use those kind of interchangeably. We'll go to communications now. We have crisis communications, and we have during communications, we want to have the crisis communication out, could be your announcement. So again, the phases of recovery and to be accounted for after the fact. The immediate recovery is who needs medical assistance. Then there's a short-term recovery that we want to have, and various departments will have a role. Again, security and anybody that was in that area that had happened will have some responsibility. In long-term recovery, part of that team should be involved in it, even that we already talked about. So I know I've given you a lot of information here so far, that the security officers and the individuals who had responsibility for locking down did not have the training specific to those tasks. Some of it was due to turnover, and there were new people who hadn't gotten around to getting it. Others had it several times but weren't current in it. Others had been told what to do, but had never been shown and been able to display competency in how to lock the door properly. And it was that door that didn't get locked that led to at least one further death. So communication, responsibility, saying what you're going to do, what you're going to say. Most of the things that I've talked about here for nearly an hour that I've been most passionate about: communication, training, education, documentation. Well, thank you very much. I hope I've given you a really good roadmap of things based not only on the two reference materials that are still here on the screen. ASI International Active Assailant is a national and an ANSI. It's an ANSI and an ISO standard. vetted at the highest levels. The IAHSS active shooter is part of a ponderance of guidelines that we at IHSS, I served on that IHSS Guidelines Council for 9 years, International Workplace Violence Prevention and Intervention Response Standard is part of the overall workplace violence. So it has a whole section just on what we are going over today. All of these things are incorporated more broadly in this workplace violence and active assailant standard. Okay, then I would just like to thank the participants for your attendance and your interest in this. I think it's a very important topic, and hopefully you have some tools now to go back and try to make your organization safer. Thank you very much.
Thank you. Thank you, Mike. That concludes the session for today. Thank you everyone for participating, and you may disconnect now. You have a great day ahead. Bye bye.